who didn't have dementia that it was lidocaine, and then when they hid it and didn't tell them, they responded and said there was a huge amount of pain relief when they knew what it was, but not so much when they didn't. Now the dementia cohort, it was essentially the same. They reported the same amount of pain when it was and when they didn't think it was. So based on that, he concluded that in a prefrontal cortex impairment, which happens a lot with people with dementia, the placebo response is either absent or significantly reduced. So now we have a group of people who don't have the placebo. So what happens if you treat those? Before I continue, I have to talk about, this was supported by Thompson et al. And Pariente et al. With imaging studies. So the rationale for point selection, as Paul very eloquently said, we're all the same, but we come from slightly different languages. So some of you are Western medical, some of you are traditional Chinese, and I'm going to briefly mention this because Dr. Christopher had already covered it. So I talk about when my patients come in, I never, I sort of tell them I'm a physio that does needles, and I talk about a couple of terms: general effects, local effects, segmental effects, and then myofascial trigger points are in a sort of category of their own. So in my clinic, I have two big posters. One is myofascial referred pain, which is, if they have upper pivotal trapezius and they got pain going into their eye. And the other is segmental acupuncture, where I have a grid, because I find that it can explain it when I show it to them. A lot of my patients, surprisingly sometimes, they ask me how it works. So how I explain is very, very simple. Local effects, I would often describe as, when I needle you, you're going to get a response. It's one of those responses is the release of CGRP, calcitonin gene-related peptide, which is a vasodilator. And they look at me blankly and I say, it's like flushing a dirty pipe through with a load of water. Sort of accelerating the arterial oxygenated blood. The segmental acupuncture requires a bit more thought. Occasionally I will have patients referred to me by GPs now for irritable bladder and irritable bowel. So say I have someone with irritable bladder. I'm going to test the pointer. Anyway. Bladder T11, L2, S2 to S4. Just to show you why I'm thinking this way, I would say to them, okay, your bladder, your organ, shares its nerve supply with a muscle. I can't needle your bladder, but I can needle the muscle that it shares its nerve supply with. And it's even better if I have an acupuncture point in that muscle, because it works a lot better. And that is how I explain it incredibly simply. But they get it. And because they get it, they're with me on the treatment. It's not me treating them, it's us together. So I always use spleen 6, because spleen 6 is a very nice point, it's easy to get to, and it's very, very useful. But the other reason is because for irritable bladder and hitting the muscle, flexor digitorum longus, it shares its nerve supply with the bladder, as we know, but the other thing is a visual. I sort of wriggle their second and third toe and they can see the needle moving. And then they realize that needle is in the muscle. So that's the segmental acupuncture. So now we're on to the actual nuts and bolts of this. I was so worried I was going to go over time, so I skipped about 36 slides. So anyway, so the three cases. So how this came about is in 2012, I was sitting in an office in the Royal Hospital of Integrated Medicine, of the BMAS London office. And Dr. Mike Cummings and me had just finished an electroacupuncture teaching course. And Mike says to me, he says, "Duncan, have you any news for me?" And I said, "You know something, Mike? I had a case you might be interested in." And then I explained the case, treating someone with dementia. Now Mike's eyes opened wide. And I've only ever heard of 2 other cases ever. And he would be a very big into research, so there was only 2 at that stage documented anywhere, and mine was the 3rd. So he got the 3 of us, the 3 independent clinicians, different parts of the world, to collaborate and to co-write a piece about it's all in the mind, or is it acupuncture for patients with dementia. And that was published Acupuncture in Medicine 2014, which was also published by the British Medical Journal. So I was just incredibly lucky.